chest was rising and falling equally and bilaterally. The thoracic cage is at a 1-to-2 ratio, which does not indicate barrel chest, so that's great. So now I'm going to have you lay down flat, and I am going to inspect your abdomen. So the abdomen is flat. There are no like palpations, abnormal palpations, and there is also no abdominal distension. So now I'm going to auscultate the abdominal regions, the 4 abdominal regions. So the right lower, right upper, left upper, left lower. So the bowel sounds are normal and active. So now what I'm going to do is I'm going to palpate the 9 different abdominal regions. So you have your right hypochondriac, you have your epigastric, you have your left hypochondriac, your left lumbar, your umbilical area, your right lumbar, your right inguinal, your hypogastric, and your left inguinal, and everything feels normal. Did anything feel tender? Did you have any pain? Perfect. Okay, so now I'm going to palpate for bladder distension. Right, perfect. So everything felt normal. Do you have any trouble like eliminating? Do you have any pain when you eliminate?
No.
Right, perfect. And then when was your last menstrual cycle?
2 weeks ago.
All right, perfect. And how long did it last?
5 days.
All right, perfect. And then do you do self-breast exams?
Yes.
All right, and how often do you do them?
Once a month.
All right, perfect. So that's normal. You're supposed to do them once a month. For males, if she was a male, I would ask if you would perform self-testicular exams, and you do the self-breast exam and the testicular exam in the shower. So now I'm going to inspect and palpate the patient's legs. So I'm going to do my hand hygiene, and then I'm going to put on the gloves. And while I'm putting on the gloves, I'm going to explain to the patient that I'm going to palpate her femoral pulse and her inguinal lymph nodes. So basically, with your inguinal lymph nodes, if you feel any tenderness or it's painful, let me know.
Okay.
So give me 1 second while I get this glove on. Okay. So I'm going to check both femoral pulses. Alright, they're both normal and 70. Usually I would do this for a full minute, but due to time constraints, I'm only doing it for 30 seconds on both legs. So they're both equal, normal, and +2 pulses. Now I'm going to I'm going to palpate her inguinal lymph nodes. So usually you would have the patient lift their gown up, but for the purpose of the CPE, I'm not going to do that. And there's deep and superficial, so first I'm going to check her deep ones.
No pain.
No pain, alright, perfect. And then I'm going to look at her superficial ones. No pain?
No pain.
Alright, perfect. So now that's done, I'm going to palpate the popliteal pulses on both sides. Alright, it's also 70. And then now I'm going to do her dorsalis pedis pulses on both sides. Alright, they're both 70, and then now I'm going to do her posterior tibialis pulses. They're both 70 as well. So now I'm going to take off the gloves, and I'm going to do my hand hygiene. And I'm going to inspect the capillary refill. So usually, if she didn't have on toenail polish, I would inspect the cap refill on her toes. And if it would go up for less than 2 seconds, then that's considered normal. And then I would check the temperature, and the temperature is normal on her legs. There's no swelling, edema, bruising, bleeding on her legs or on her lower extremities. So now I'm going to have the patient close her eyes, and then I'm going to have her tell me what toe I'm touching and what foot it is, okay?
Left big toe.
Perfect.
And right, I believe that was the second over from
Yes.
the pinky, the one next to the pinky toe.
Yes.
I don't know its name.
Perfect. So that was perfect. And now I'm going to test for plantar and dorsiflexion. So first I'm going to do plantar flexion. I'm going to have the patient push forward like she's accelerating, and perfect. She did that normally. And now for dorsiflexion, I'm going to have the patient push her toes to her head, and she's doing that perfectly. Perfect. So now I'm going to have the patient turn over, and I'm going to assess the lower back and sacrum to see if there is any swelling, redness, pressure ulcers, or any type of bleeding or drainage. And I do not see any. Everything looks perfect and normal. So now I'm going to check the patient's pulse, radial pulse, before I have her sit up. Alright, and it is 70, so I'm going to have the patient sit up facing me. Alright, perfect. And then do you feel dizzy right now?
No.
Alright, perfect. So now I am going to, so I'm taking the patient's pulse, and there's no signs at 70, so there's no signs of orthostatic hypotension. So now I'm going to have the patient lift her arms up, and then bring them down, and then there is no redness, swelling, any signs of cuts or bruises, or any open wounds. So the front of her arms are normal, so now I'm going to have her turn her arms like this, and I'm going to have her bend her elbows. Perfect. So, and there's no redness, swelling, no bruising or no open cuts or wounds. So her arms are normal. So now I'm going to test her range of motion in her wrists. So I'm going to have her just twist her wrists like this, up and down and side to side. So everything's normal. And now I'm going to test the patient's strength in her hands by her squeezing my fingers on both hands. And she does that strong. So perfect. So now let the patient close her eyes. And then I'm going to touch a finger on each hand. She's going to tell me what hand and what finger.
Left pinky finger.
Okay.
Right middle finger.
Alright, perfect. So then before I move on to anything else, I'm going to assess the patient's capillary refill on both hands. Perfect. And it goes up in less than 2 seconds, so it's considered normal. And her skin turgor is normal. There is no redness, swelling. The temperature is normal. It's not too hot or too cold. So now I'm going to test the patient's, and then also before I continue, the patient doesn't show any signs of clubbing, and her nail beds are at 160, which is perfect. So now I'm going to test the patient's reflexes. So I'm going to do her radial first on one side. Perfect. And then the radial on the other side. Perfect. So then they're both equal. And then I'm going to do the tricep on this side, and then the brachial and the bicep. And what I meant to say, I'm going to self-correct. This isn't the radial, this is the brachioradialis reflex. And then I'm going to do the brachioradialis reflex on this side. Perfect. And I'm going to do the brachial reflex on this side. Perfect. And then I'm going to do the bicep reflex on this side. Perfect. And then the tricep reflex. Perfect. So she is showing perfect normal signs in her upper extremities. So before the patient stands up, I am going to make sure that the bed is lowered to the lowest position and that the wheels of the bed are locked. And I am going to take her, I'm going to assess her radial, brachial, and ulnar pulses to make sure that they're equal and normal. So let me do the radial first. Perfect. And then the ulnar pulses. Okay, so the radial and ulnar pulses, they're both 2+ and equal. And then now I'm going to do the brachial pulses. And they are also 2+ and equal. And then I'm going to check one radial pulse one last time before she stands up to make sure that she can get it. Okay, so her pulse is 70, so she's not showing any signs of orthostatic hypotension, so the patient can stand up. And then now I'm going to take the patient's pulse again. it's still 70, so that's normal. So I'm gonna have the patient stand to the side of me and then walk 5 steps forward. 2, 3, 4, 5. And then I have the patient walk 5 steps back. 1, 2, 3, 4, 5. Perfect. And now to assess for low doses kyphosis or scoliosis, I'm gonna have her bend her back and touch her toes, and she doesn't show any signs of lordosis, kyphosis, or scoliosis. Perfect. So now I'm gonna have the patient lay back down, like that perfectly, or sit back up perfectly, and then I'm going to assess her her patellar reflex and her Achilles reflex. So I'm gonna do it on both sides. So here's the first patellar reflex, and that one was normal, and then the second patellar reflex, and that one was normal, and they're both equal. They both did the same things. And then now I'm going to assess the Achilles reflex on this side, and that one was normal. And then I'm going to assess the Achilles reflex on this side, and this one was normal. So all of her reflexes are normal in her legs and her arms. So now I'm gonna put the patient back in bed. I'm gonna lay her down. I am going to give her call light back. I'm going to put up either 2 or 3 of the handrails. I am going to let the patient know that all of her results, all the assessment findings are normal. I'm going to ask her if she needs anything.
Nope.
Nope. All right. I am going to make sure that the head of the bed is at its lowest position and that the wheels are locked. I'm going to open the curtain, and I am going to do hand hygiene, and before I leave, I'm going to let the patient know that I will be documenting at the nurse's station.
Okay, sounds good.
All right, thank you.
Thanks.